It's a long day. I feel for you poor people. If you look at the schedule, it's like 13 hours with the exam material afterwards. And I just want to spend this next half hour just talking to you a little bit about test taking. I've spent a lot of time working with residents who are struggling with in-service exams. I've worked with medical students who've had trouble with step 1 or step 2. And I've also written a lot of questions over the years and written exams for residents. And that experience has led me to some sort of take-home points that I want to share with you. The other thing about people who are taking a recert exam, though, is you're just not a lean, mean test-taking machine anymore. Once upon a time, you probably were. You had to be to get into medical school and to get through all those things, the MCATs and all of that. But as you get into practice, you drift away from that and you become much more of a clinical animal, which is very different from test-taking. Within test-taking, there's a lot of sort of word clanging and biz-buzz stuff, and I just want to talk about some strategies as you approach this exam about focusing on a few things, just a few things that can make you better. Some of these strategies I have shown repeatedly when I've worked with people. Without really fundamentally changing their knowledge base, I can improve their scores sort of in the 10 to 20% range, which if you're hovering sort of around a passing score, obviously that gets you to safety. Gets you over. And so we'll talk about that, and within that, we're going to do some of the basic things you'll hear, and I'll emphasize those. Obviously, you want to read the question carefully and note the key words within the question and the key findings that they're noting, that they're putting in there for you, including some vital signs, and you want to then go down and start eliminating wrong answers. If any part of the answer is wrong, it's wrong. Don't get sucked into part of it seeming right with a wrong element. It's wrong if it's part wrong. Assume worst case scenarios, and by that I mean it's a test of emergency medicine. People come to the emergency room for you to do something. I work with residents who are like, well, I don't know if the abscess is ripe yet. Maybe they need a couple. I'm like, really? You're going to send them home, have them come back 2 days, wait 8 hours to be seen to get an IND then? Cut it open. For God's sakes, they came here for you to do something. So in general, emergency medicine and the test questions want you to assume that the patient needs to have something done. There are very few answers where the correct choice is reassure and discharge. About the only one that I know of where that's the answer is a subconjunctival hemorrhage. Right? The patient comes in and says, doctor, I think I'm having a stroke. No, it's a subconjunctival hemorrhage, reassure and discharge. Obviously, if you don't know what the answer is, you can guess. There's no penalty for wrong answers on these. And one of the main things that I'm talking about here, and we'll get into this, is making you a better guesser. So for example, if you read a question, you have no idea what it's about, and you were to just randomly choose out of 5 choices, you have a 20% chance of getting it right. But if for every choice you eliminate and then guess from the remaining ones, your chances of getting it right go up a lot. So if you can eliminate 2 of them as being obviously not correct or not right, then you're guessing out of 3. Now you have a 33%. You went from 20% chance of getting it right to 33% chance of getting it right. And if you can get it down to 2 choices, you have a 50-50 chance of getting it. And so doing the work, because it is work and it's a bit of an endurance test, doing the work to improve your guessing. If there are 25 or 30 questions that you can change from having a 20% chance of getting them right to a 50% chance of getting it right, that'll increase your score quite a bit. And so becoming a better analysis of your choices is really critically important. Unfamiliar, wordy information, usually wrong. All or none is not there. Choose gold standard answers, not the thing you read last week, right? They're not going to be examining the paper that was written last week that's trying to change the standard of care. That's just not how these exams go. These exams, which are high-stakes exams regarding your board certification, are going to have standard right answers, and these questions have all been really vetted, so similar ways of interpreting it. If there's 2 choices that are close, they're going to eliminate one of those choices so that the answer has a clear best answer. These questions have all been vetted, tested. They've all had Pearson correlation coefficients done on them. And that's why ABEM is very specific, for example, and as is any other standardized exam, about protecting their questions. Every question on the exam represents a lot of work. So when you talk about the cost of the exam and the protection, and I've already been smarmy about ASEP protecting their information, no, they do so with good reason, and ABEM protecting these things, because each of these questions represents a lot of work and a lot of effort to make sure that they work to be a standardized test. So that's why they protect it so much. On the flip side, outdated old information is wrong, and obviously negative physician behavior is going to be wrong. So the common mistakes that everyone knows is not reading the STEM carefully and understanding exactly what they're asking. Having noted that, when I've worked with people who struggle with exams, when they get to a question they don't know the answer to, they don't spend much time looking at the choices because they don't know so they keep reading the question over and over and over again. And yes, you can read it a second time to make sure you've read it carefully. You might even read it a third time. But I see people perseverate and keep reading the STEM, that's the question part, over and over again. No, stop. Once you think you're sure you understand what the question is, now, and you don't know the answer, you've read it and you're like, I don't know what they're after here. Now you need to go down and start thinking about how the choices relate to that question. And oftentimes, even when you have no idea what the answer is, you can get there, or a long way there. You can get to 1 out of 3 or 1 out of 2 by spending the rest of the work analyzing the choices that have been offered up to you. And that's called FOIL analysis. So every question has a couple of parts. The STEM is the question, then there's the right answer, there's the answer, and then there's 4 FOILs. And doing FOIL analysis is something that many test takers don't do, or they don't do it well, or they haven't really thought about much. FOIL analysis is really how you increase your score without changing your knowledge base. Why are you guys here? You're here for this symbolic 3 or 4 days of torture, 12-hour days. All it is really symbolic for you to say, I made an effort to go through it. I'm not going into the exam naked. And that's why you come to these things. Most of you are going to do fine, but to get to the next step, we have to improve your test taking and talk a little bit about how you deal with these things. The exam has some pictorial components to it. So we'll talk about that next. So read the question, and I remember that sometimes you read the question and you're like, I have no idea what's going on. What's in this picture? And so you look at the picture, look at it carefully, try and decide what it is that they're showing you, and then again, progress down to reading the question and seeing what the choices are, because sometimes you'll be looking at the picture and you're like, I have no idea. I remember one year when I was a resident, the first exam question was a close-up of a buttocks and an asshole. And I couldn't even tell what it was when I was looking at it. And then it finally became clear when I started reading the questions that it was a thrombosed hemorrhoid, and then I knew what to do with it. And I was like, they really started the exam with the very first question of close-up picture of an asshole? I was like, the gloves are off. This is a hockey game. I'm throwing down. We're going to get into an argument about this. And you have to know what your exam-taking persona. I'm an angry exam taker, but I can't get too angry because I get disorganized. Some of you are you're like the granola, meditative test taker. But whatever it is, part of the reason you do practice questions for a while before you do the exam is to perfect whatever your test-taking persona is and get into that mode. Because it's not clinical practice. This is an exam. It's adversarial by definition. Some of you have angry adversarial test-taking skills, and I do that. When I was a resident, remember how you could put the X on the in-service exam and tell them you had comments? I'm sure when they got my exam back, they would gather around, get some beer, this should be good. But I would write all kinds of comments about the exams, and we'll show you some of the kinds of comments I would write. There are some calculation questions every once in a while, calculate the corrected sodium, things like that. If you do the calculation and the answer's not there, okay, repeat the calculation once, make sure you didn't screw it up. But if it's still not there, they're using a different formula. So you're going to have to do your best with that. And I see sometimes people taking exams really perseverate and get all bogged down in these calculations rather than sort of doing their best and moving on. If you do the calculation and it's not there, make sure you've done it correctly, but then sort of realize it's probably another formula and start thinking about whether you know another way to get it. These are some of the typical formulas that are out there. What's the anion gap? What's the osmolar gap? We've talked about all of these. The Byrne formulas, there's the Parkman for you. Pediatric endotracheal tubes, right? Age plus 16/4, depth 3 times the internal diameter. These are all sort of common things that they might ask. But if you do it and the numbers aren't there, think about it again and see if you can get there another way. So, I don't want to get into huge detail on this, but if you knew nothing about the answer, you should choose B or D. If you couldn't eliminate anything, when I was at McGill University as an undergraduate up in Montreal, they would give us exams where there wasn't enough time to do them. You not only had to do the exam, but you had to move really fast. And people afterwards would stop and they'd go, well, how'd you do? And you'd be like, I had to B out. That means you put a ruler on B at the end of the exam and went for the last 20 that you couldn't get to. That's being out. And we even had a little formula for us there as undergraduates to try and make sure there was negative correlations for questions, and it was B, D, A, E, and C. You choose the first of those letters that you couldn't rule out. And it shows right within that, B and D are the most likely. And just think about, if I was asking you a question about what was the probability of X, 0% would be A, 100% would be E, and different shades, 50% would be C. Well, if it's 50-50, it's probably not a good question. That means C isn't right. If it's 50-50, you don't ask. If it's 0 or 100%, you'd probably kind of know that. Also not a very good question. So you're already to B and D just by that logic alone. Every medical student knows this. When you ask them, how often do you think this happens? If they think it happens not often, they answer 20%, because 20% is almost right for 10 and almost right for 30. It gets you an error on both sides. 0%, there's no error less than 0%, so you only get one tail. 100% similarly doesn't give you any error on the other side. And as I said, 50-50 is not a very good question to ask. There's also things about verbs and consonants and vowels that go with this. The way they randomize the choices for the exam is purely alphabetical. So if you had a patient collapses in front of you, choice A would be activate EMS. Choice B might be begin CPR. Choice C would be call for help, but that's how they do it. They alphabetize them. And there's some things about verbs. If you want the answers, the choices to be as short as possible, you would often start them with verbs. Now, verbs in the English language, and this all gets very technical, it goes back to the B or D thing. But verbs in the English language, some verbs start with consonants, but a lot of verbs start with vowels. And are there more verbs that start with A and E than O and U? Just open your dictionary. There's a hell of a lot more words that start with A and E than O and U. That drags you down towards the first choices. Again, B, the best guess. All right, some general advice about the thing. Don't study the last day. And I have to caution you, because some of you are ER docs here, unless it's going to be the only day. In which case you might do things like look at some of the antidotes or a couple of the rheumatology things or the pediatric rashes so you can get a couple questions right. Know where the test center is. A lot of these are at these test centers. If you have to drive to the test center, don't drive the day you're taking the exam. Drive in, rent a room, know where it is, get comfortable so you know where you're at. Dress comfortably, be well and rested and ready to focus when you get there. They're going to take everything away from you, not even a watch. If you have a calculator watch, they'll take that away from you. They're very serious about that at these testing centers. They put everything in a locker. All you get is a pencil and a blank paper so you can write some things. It's on the computer. The questions are in blocks of, I forget, 20 or 30, something like that. You can move back and forth within a block of 20 or 30, but when you leave that block, it's over. So you got to treat each block sort of as a separate exam. So once you leave the block, it's over. You can't go back. Obviously, you can't write on the computer screen. I used to like paper exams because I could write on the exam and circle things. If you've not done this, you could do a practice session at the test-taking center. If you want to go and if you've not done one of these at the center exams, you can do a practice session. But obviously, you're on a computer, so you can only write on the paper you have that's blank. It's an unfamiliar format. How many of you have been to one of these test centers before? So many of you have, because we've been doing this for a while. But if you haven't been, and this is the first one, find out where it is, go there, check it out. If you want to do a practice session, that's allowed. All right, now we'll get to the format of what a question is. There are questions, they all come organized the same way. There's the body and the stem, that's the question. There's the correct answer and 4 foils. All of these are going to be out of 5, so 20% chance of getting it right if you knew nothing, and we're just guessing. There are no negative questions, by the way. Except questions, they've decided that negative rationale, they're out. All of the questions now have been designed to have an affirmative answer. I personally think that's a little bit unfortunate because in emergency medicine, we do lots of things using except thinking. I can give them this drug unless they have this. So we do a lot of except thinking, but there are no except or negative questions. There's no true-false questions, but in the old exams, why would you B out rather than D out? If you didn't know what the questions were, you didn't have time to get to them? Because D looks really bad if there were 10 true-false questions at the end of the exam. But anyway, you don't have to deal with that. But there are certain question types, and we're going to talk about that because knowing what the question type is really helpful for you in terms you think about it. So let's do some things. Here's typical questions. It's a classic question. Which of the following does not transmit rabies to man? They already would have a problem with that because it's a negative question, does not, right? And here's your choices. So let's just be in your head. You're taking the exam. Raccoon, yeah, raccoons do. I know they have the problems with the raccoons. Skunk, oh yeah, I had a skunk attack me last week. Skunks do it. Mongoose. You're like, what's wrong with these assholes? Why would they put that choice in there? I don't know if they do it. I'm not in India. It's not Ricky Tikki Tavi. And they're smarmy about it, right? There are mongoose in Hawaii and in the U.S. Virgin Islands. So it's a fair question for the U.S. They know you don't know it. They know you don't know it. It's a destabilizer. Exam makers do this intentionally. They'd like a little sweat in your armpits when you're taking the exam. So you're like, okay, mongoose, I don't know. Rabbit. Never heard of a rabbit rabies case. I don't think rabbits do it. Bats. You're like, all right, bats definitely. So let's just stop there. So you know bats do. You know skunk do. You know raccoon do. You're down to mongoose and rabbit. Right? And you just have to be a little bit logical thinking about the examiner. Do they really want me to know something about mongoose, or should I just disregard that and take rabbit? Absolutely. That's what you should do. The idea that they're asking an important test question where you need to know about mongoose, that's ridiculous. It turns out mongoose do transmit rabies, and rabbit is the right answer, but you have to get into the examiner's head a little bit. Now, why are there sometimes weird choices like mongoose in a question? One reason they're in there is if you've written in an exam, and I've written lots of them, you could think of questions left, right, and center, but thinking of bogus wrong answers is really hard. It's really hard. That's why when you're writing an exam, you're like, Guillain-Barré is a choice over and over. You'd think there's some Guillain-Barré epidemic out there. And that's because they can use it on neuro questions. They can use it on GI infection questions. They can use it on all kinds of things, physical exam questions. So they love Guillain-Barré. They can put it anywhere on the exam. And one time out of 10, when they put it on the exam, it might be the right answer. But they know it's kind of an unfamiliar thing that you sort of know, you should know, but you don't have the details, so they throw it out there. Same with Eaton-Lambert. These are 2 examples of classic hyphenated things that they throw out there. They're like all over the exam. You're like, really? You'd finish the exam, you'd be like, Jesus, I must not know enough about these. No, they're having a hard time coming up with a 5th choice for the question. And sometimes they do something smarmy like this and choose mongoose, where it actually is important in the United States, but you don't know that. And so you got to sort of do this sort of foil analysis, not just for the facts, but what is the examiner sort of thinking and asking? Would they really put that as the answer to this question, mongoose? This is a question for my board certification and everyone else who's taking it around the country. Really? No, they're not going to make it mongoose. That's just this classic destabilizing move. And that's why I can write the exact same exam, same questions, same answers, and I can make that exam an exam that almost everyone passes, or I can make that an exam that almost everyone fails. Same questions, same answers. I can just make the choices a lot harder, the wrong choices. And so once you understand that, and that how hard it is to come up with 4 wrong choices, then you start understanding, they threw out Guillain-Barré again. They couldn't think of another wrong answer. Another Eaton Lambert. Has nothing to do with cancer, and you'll get used to it. But these are fact questions. And so even in a fact question like number 1 on this slide, without knowing the answer in detail, you got down to a choice of 2, and there's really, you have to be an idiot to choose mongoose. You should get this question right, even though you only knew 3 out of the 5 things. You should get it right. Let's go to another fact question, the next one. Which of the following ACE inhibitors causes a skin rash? I see questions like that, and I'm like, what the hell am I, the PDR? I'm already irritated with the examiner. And so there's no way to know the answer, and they give me captopril, lisinopril, benazepril, and isopril. So there's a couple of ways you could look at this. You could look at this and go, well, there's 3 ACE inhibitors, and only 1 that isn't. Maybe that's got to be the answer. You'd get it wrong. The actual answer is A, captopril, because it's the only ACE inhibitor with a sulfur group in it, and it causes a lot of skin rashes because of that. But there's no way to figure it out, really. And so it's a fact question. So one of the rules is when you're confronted with a fact question, you're still going to do the FOIL analysis, but don't get hung up. If you don't know it, make a choice, get out of there, move on. The 2-parter, make the diagnosis question. This is very typical of exam writers. So let's do this question together. 28-year-old woman on oral contraceptives, you're circling it, all right, she's on birth control pills, presents with gradual onset chest pain, myalgias, and shortness of breath. The pain is worse when she lies flat. When you see a sentence like that, the pain is worse when she lies flat, they're after something pretty specific with that. It might not ring a bell for you immediately, but you should be looking at like, why did they put that in there? And then the question is, which diagnosis is much likely? I still don't know what she's got. So now you start looking at them. And you're like, oh no, Dressler's syndrome. All right, so many times when you're in this situation, what happens next? You're like, what do I know about Dressler's syndrome? And we've all been there. I'm not making fun of anyone. File not found. You might have some loose recollection of, it's like some post-MI thing. She's 28, for God's sakes. It doesn't sound like an MI. So you're like, all right, I don't think it's Dressler's, but I'm still, I'm open to ideas, but I'm putting Dressler's on the back burner. Then you go down, Chagas disease. You're right back where you were with mongoose, you assholes. Really? I don't even know where the apostrophe goes. Is it spelled right there? Does it go after the A or after the S? This is that thing with the bug that bites you. It's down in, Peru. Really? They're asking me about Chagas disease? They should have at least said 20-year-old woman goes to South America. So I'm just going to put that on hold. I don't know if that could be it. Acute pericarditis. What do I remember about that? And then you start looking, oh, myalgias, that sounds viral. Remember, pericarditis, most common causes are viral. Echo, Coxsackie virus, all right. Myalgias, a little shortness of breath, chest pain, gradual onset. That could be, that sounded pretty good. And then you're like, but she's on the birth control pills. Doesn't that mean it's a PE? Which is the next choice. And you're like, wait a minute. A lot of young women of reproductive age on birth control pills. Is that a valid red herring for them to throw? Because they're not going to throw bad red herrings at you. But a young woman on birth control pills, that's a totally reasonable red herring. And so now you recognize what's going on here. They're throwing you the oral contraceptives to make you think that this young person with chest pain and shortness of breath has a PE, but they're giving you lots of information there to dissuade you from PE. It's gradual onset. She's got myalgias. It's worse when she lays flat. Oh yeah, pericarditis does that. They like to sit forward and hunch forward when they have pericarditis. You start remembering some things. It starts coming through. And now you got the question figured out because you spent some time thinking about these things. And now you know it's not Dressler's, which is the post-MI autoimmune thing 4 to 6 weeks out. It's not Chagas disease with the trypanosomiasis and the heart failure. It's acute pericarditis. And maybe even myocarditis if they were to offer it. It's not a PE. The birth control pills are a red herring and a totally fair one to throw in there. And it's not Tietze syndrome. And so what we're looking at here is this detailed thing. And so these questions become work because you got to spend time thinking about all 5 choices and dissecting them a little bit. And that's FOIL analysis. 2-parters, I used to hate these. A hiker from Connecticut presents with a Bell palsy. It should be Bell, right? It's not actually Bell's palsy, although we say it all the time. Presents with a Bell palsy and a rash. which treatment is best. You're like, it's Lyme disease. Oh shit, I have to know the treatment. I don't know what the treatment is. That's why I have that little book with the Chinese characters to look it up. I don't remember all the treatments for every organism. Jerks. They're like, all right, let's look at it. Amoxicillin, 500 TID for 10 days. Might be. Head CT and NSAIDs. Well, I know that doesn't cure anything. That's out. Bactrim, it's another broad-spectrum drug. Could be. Valcyclovir and prednisone's a bad idea. I know that. So E is definitely out. It's not viral. So D and E are out. So you might just surrender there. I don't know if it's Bactrim or amoxicillin, but just choose. Wait a minute. Slow down. Slow your roll down. Look at all the information they give you. Bactrim, double strength, for 3 days. This is a disease that gets into your brain, right? They're even proposing that they've got Bell palsy from it. What disease that gets into your brain do you treat for 3 days? No, it's got to be longer than that. So even if Bactrim was an option, I don't think it's for 3 days. So that little part in there, 3 days, we only treat urinary tract cystitis we treat for 3 days, something that's easy. Not something that has all the potential problems that Lyme disease has. So you, again, even if you didn't know much about this, you ought to get amoxicillin for 10 days. You ought to be able to work to that. And so this is about really working hard on your foil analysis. And by the way, I would mark this test question with an X and send it back to them and remind them, you can't call it a Bell palsy if it's Lyme disease. Bell palsy is when it's idiopathic. So you should have said the question to be correct, should have said with a peripheral seventh nerve palsy. Jerks, it's wrong question. It's not a Bell palsy. Now, I used to hate these questions until I started writing them. So you have these questions where you turn and look at the question and it's like this. You're like, what is this? Reading Comprehension 101? Ask the question, why does there have to be a paragraph first? I have learned since, when I wrote questions, that when you see a long question like this, it's all just about camouflage. You're looking for the 2, 3, or 4 salient points in that paragraph that tell you the answer. So if you knew that this is all about camouflage, let's do it. A 75-year-old man has weakness, dizziness, and nausea. That is all very nonspecific. So I got an old person who's not feeling good. With ataxia. Now, ataxia is a hard neuro finding. All right, I'm circling that. He's got ataxia. I got an old man with ataxia. He's confused and unable to provide a past medical history or family information. That doesn't help me. He denies seizures and has no evidence of, now we're into one of these weird sentences like the other one about laying flat. He denies seizures and has no evidence of tongue biting, but his pants are soaked with urine. What the hell are they getting? Oh, he has incontinence. I have an old man who's ataxic with incontinence. His EKG is normal. Thanks for nothing. So glad you put that in there. It's been really revealing to me with regards to my, right? It's camouflage. I don't even know what he has yet, and they want me to tell him a diagnostic approach. So you could raise the white flag of surrender and choose B right now and say, I'm never going to figure this out. I have no idea what they're talking about. But don't do that. You still have work to do. Let's go down and do the foil analysis. A SED rate to rule out temporal arteritis. Temporal arteritis is the headache with the knobs on the head and the super high SED rate. This isn't about headache. Temporal arteritis patients are usually have normal mental status. So A is wrong. I'm already done with A. A head CT to assess for normal pressure hydrocephalus. Normal pressure hydrocephalus. All I remember about that, it's the wet, wacky, and wobbly. Oh, wait a minute. He's got incontinence. He's wet. He's got ataxia. He's wobbly. And he's confused. He's wacky. That's it. So even if you'd surrendered and guessed B, in this case, you would have got it right. But let's keep going. LFTs to rule out hepatic encephalopathy. I'm given nothing here to suggest hepatic encephalopathy. CPK-BB, obviously wrong. When was the last time you ordered one of those? Right? What is it, 1970? No. And a carotid angiogram for barrier aneurysm. This doesn't sound like an aneurysm. That's sudden onset headache. So we got this gradual stuff. He's wet, wacky, and wobbly. It's B. It's normal pressure hydrocephalus. And now with great confidence, you move on. If they'd asked the question this way, what's a geriatric patient with ataxia, dementia, and incontinence have? It would have been too easy. That's why they wrote this whole paragraph, was to disguise it, to check your ability to prioritize information and do some deductive reasoning about which of the things in that paragraph were important. You might say to yourself, come on, please. You know, it's a risk. Give me the question, the real question. But no, they don't. So whenever you see a long paragraph like that, they're hiding the key information among other information, and they're asking you to prioritize which data is the most important. And once you know that, now that I know that, because I've written questions like this, I actually don't dread them anymore. It's just like a little game. Find the key facts. There's usually at least 3 key facts in a paragraph, right? Many diseases have triads, like wet, wacky, and wobbly. It's always a triad. And when it's 2 features, it's not enough to be specific for the disease. Once you get to 3, once you get to a triad, you can start naming diseases. So in general, when you see a paragraph, you're looking for 3 things. The 3 important things, what are they? Concept questions. You would think that for a certification exam of a practicing doc, they could ask you the concepts of your practice, and that would be a great way to determine if you should go forward. The problem is concept questions are really hard to write, and identifying a concept which you can make wrong choices to that are believable is also exceedingly hard. So there aren't many concept questions. In fact, they're decidedly the unicorns of the test. On a test of 200 questions, there might only be 4 or 5 of them because they're that hard to write. This is sort of a bad example of one, but which of the following organs is susceptible to barotrauma? So it's a concept. What do you know about barotrauma? Well, it's all about pressure changes. Okay, I know that. And pressure changes, liquids don't change volume, but gases do. So it's got to have gas. It's got to be a gas-filled thing. So last I checked, the liver has no gas in it. So liver is not particularly susceptible to barotrauma. I'm looking for the lungs. Where are the lungs? Oops, the lungs aren't a choice. All right, the spleen. Well, like the liver, it's got no gas-filled spaces in it. Sinuses. I worked at the dive chamber. You see all kinds of people with sinus squeezes and sinus barotrauma and over. Sinuses are good. That's possible. Spinal cord. I know you can get decompression sickness, but that's more about dissolving gases. That's a disorder of time and depth. That's not really barotrauma per se. Barotraumas are disorders of ascent or descent. Back to the concepts. So I'm still with sinuses, and the heart, no, not really. So I'm going with C. It's going to be right, but I would mark an X on the question. What would I say to the examiners? Hey, assholes, the sinuses are not an organ. It's a bad question, you losers. I would think that the item writers for my American Board of Emergency Medicine exam might acknowledge which structures in the body are organs. That's what I would write on the exam. And I would write the hey assholes. I used to do this on my in-service exam every year. I know they looked forward to it. I'm sure when they came in, the scores were like, get Malin's exam. Let's get together and have a pizza. This will be fun. There are research questions on the test, too. I remember one year I was writing the exam, and there were like the same question about when to do a retrograde urethrogram. We're going to do this tomorrow in trauma, but they asked it like, it was the same question, but there were slight variations with some different choices. And all they were trying to do is to figure out which of those versions of the question had the best correlation with passing the exam. I knew at the end of the exam that those were test questions. Get over that. Don't try and figure out what's a test question and what's not. They are there. You might see some test questions float by you that have sort of the same impetus over and over again. They're just trying to figure out which way it goes. So, you guys are in the early group. This is the first review course. You have some time. You're here to get started. You got this notebook now, and you might be getting peer exams to do. By the way, let's just talk about peer for a second. People ask me which exams to do. So peer 7 and 8 are really, really detailed. They'll freak you out if you take them right now. I'd fail one if I took them right now, and I live in an academic world. I write these questions. I do the board review. So if you're going to take I like Peer 5 the best for preparing for this, but Peer 5 is really hard to find. Peer 5 is a really sort of straightforward kind of peer exam, But ever since then, they've gotten a little more esoteric. The 1,200 question, and I have no stock or holdings in any of these, the 1,200 question book is fine. You can do Rivers. Rivers, I think, is generally better for the oral boards, but you can do their board prep. But the key thing is you need to start doing questions and to start practicing your FOIL analysis. Now, I find it super useful that as you're doing test questions, if you write down the FOIL that got you, and you just write it down on a piece of paper, and then after you're done doing your practice questions, you go and look up that FOIL. And I'm not talking about reading a whole chapter in Rosen's. You just look it up maybe online and pick out 3 facts. I bit on this thing, this choice. What do I need to know about it? And maybe you bit on Guillain-Barré when it wasn't the answer. So you look it up and you go ascending paralysis, loss of reflexes, and then you might learn that there's a bulbar version of it that's called Millar-Fisher variant. You'd like make a little, just a few little facts about it so the next time you'd get this right. And that's called studying by your own killer foils. And what's a killer foil for you may not be for you. So as you are preparing for your exams, each of you would make a very independent list of killer foils. And as you get to a couple weeks before the exam, studying your killer foils becomes really super useful way to improve your score. And it's a very personalized way. These are things that you personally have been tripped up on while you were doing exam prep, and knocking those out of the way will prevent it from happening again. I see people who get questions wrong, and you tell them what the right answer is when I'm working with students, and then the exam comes to the same question, they got it wrong again. I'm like, that's inexcusable. You got to at least knock out the things you've been getting wrong. And the last thing I would talk to you about is just what to study. And we have this now book, and we already talked about this, making a list of killer foils. But when you're studying, there's a tendency to want to do the things you love. I like ortho. I do all the ortho for the emergency medical abstracts and stuff like that. But I shouldn't study ortho. I should read the stuff I hate. And that's why some of these little sections like Peds GI or some of the rheumatology or the rashes, the derm is all very good. Maybe it's a little ophthalmology. But break it up into bite-sized chunks and study it and be a condenser and get some things down. But if you study the things, start with the things you hate, ironically, the things you hate are where you're increasing your score the most. When you study the things you love, you probably were already going to get those questions right anyway. So don't study the stuff that's familiar. Study the stuff that's unfamiliar that you hate. And so it should be very easy for you to look at this book. Oh, the cancer stuff or the HIV stuff. I don't see that many of those. Wherever it is you work, the things you don't see. Environmental is a really great one to study because no one's really an expert in it, right? It's not like you can live near a mountaintop and see high altitude illness and rattlesnake bites. You either got one or the other, or none. And so the questions in environmental are going to tend to be pretty straightforward. There won't be a ton of them, but a quick review of environmental, it's kind of fun. You'll pick up an answer or two. Remember that there's going to be some peds, there's going to be some gyne, there's going to be some trauma. So I think the gyne trauma and some of the gyne topics, they're really sort of great ways to pick up quick points for the stuff that you haven't seen that much of. So study the unfamiliar stuff. And then when you're doing practice questions, start working on doing better and more detailed FOIL analysis. That's why books like the 1,200 Questions, which explain why the answer is wrong, are very useful because the FOIL analysis is given for you right there. So when you compare your FOIL analysis to the explanation of the answers, including the wrong ones, that's a pretty good way to study. Other books that have, exam books that have the wrong answers and why they're explained, those are much more useful than ones that just have the question with the right answer explained. You want to know why the wrong answers were wrong. How were you fooled? Why did you choose it? And so I find that will be the most useful. And if you get better and work harder, and it's exhausting, I'm not going to pretend it's fun, doing an exam with 200 questions with detailed FOIL analysis on all the questions that you don't know the answer to, it's a lot of work. You should leave the exam tired. And sometimes, it's an endurance test, and I just don't have the patience. So finally, when I'm writing exams, finally I just can't even look at them again. I'm done. I'm out of here. So you have to do that. But it is, and that's why when you're doing practice, I hear people saying, oh, I do 20 questions a night. No, you don't have the endurance to take the exam. Every once in a while, you need to sit down and do 200 questions because it's an endurance test as well as a knowledge test. You don't have to do 200 questions every time you sit down. I like doing blocks of 20 or 30 at a time when you're studying at night or whenever it is you study. I'm a night person, you might have gathered that. I learn most of everything I know somewhere between 11 and 3 in the morning. Asking me to learn something at 9 a.m., I'll go to rounds and stuff, but I'll just listen and sort of let it wash over me. I don't learn it until it's late in, small hours of the morning. But some of you are morning people, whenever you do this, but every once in a while you have to sit down and do a big block and start working on your endurance because you haven't been doing this. All right, thank you very much. They're going to do the review session right now.